So, moving on to the next session of our live show, we are going to be having a dermatologist joining us shortly. And let me tell you a little bit about this dermatologist. We have Dr. Soumya Sachdev joining us today. She is practicing in Max Super Speciality Hospital in Ghaziabad. Dr. Soumya is a consultant dermatologist, cosmetologist, and a hair transplant specialist. She has won multiple accolades for her contribution to the medical industry, and her work has been published in multiple publications and medical journals. She will be joining us shortly. So if you guys have any questions for Dr. Soumya, please drop them in the comments below, and she will be answering us all of our questions. Hello, Dr. Soumya. Welcome to today's live show.
Hi.
Thank you so much for joining us. I'm good. How are you doing?
I'm good.
All our audience is all here waiting for you to answer some of their very concerning questions about skincare. So we're really excited to be having you on this show today. Thank you for taking your time out and joining us.
Thank you.
So since Holi just passed, a lot of our users are also concerned about what the skincare remedy should be and how do you actually get the color off your skin. So could you tell us a little bit about that?
Post Holi, the problem, first of all, that you have to follow certain things pre-Holi, so that is done. So let's talk about post Holi. So the colors are still staying with many of us. So one thing, don't scrub too much. We have this urge to scrub it off all in one go when you cleanse your skin. That is actually a wrong thing to do, because when you scrub it off too much, that will actually lead to friction, and that will increase the inflammation on your skin, and that will increase the reaction that your skin is facing. So don't scrub it too much. Rather, cleanse your skin 2 to 3 times. You can even do it 4 times a day. So do that, and based on your skin type, use a cleanser. So if you have oily skin, then you should use a gel or a foam based cleanser, and if you have a dry skin, then you should go for a non-foaming creamy cleanser. That will be the best one for you. So that is what I would suggest, to cleanse more rather than too much of scrubbing and being too harsh on your skin. Also, don't exfoliate too much for the next 48 to 72 hours. Don't go for too many procedures, parlor procedures, even chemical peels, salon procedures, anything for that matter. Don't do that. Avoid actives. If you have color staying on your skin, I would tell you to avoid actives. But if your color is gone and your skin is now okay and you want it to regenerate back, then hyaluronic acid serum is a good option to go for. Other than that, I would suggest you to moisturize and use sunscreen. That is the must that you should do.
Okay, so did you guys hear that? Like Dr. Soumya just said that we should avoid scrubbing our skin when we have color stains on our face. I feel like my go-to was to just scrub it off and wash it so that, I get rid of the color. But now I know to do better and gently just exfoliate, not exfoliate, gently cleanse it multiple times a day and take care of your skin, right? Until the color is gone, we shouldn't be using any active ingredients. So, Dr. Soumya, could you just elaborate a little more about what does active ingredients mean?
Yeah, so there are a number of active ingredients. Before I joined, I was listening to your session, and you had asked the people who have joined that how many people use serums, and a lot of people did write, I do. So actives are what you use in your serums, and they are of multiple types. You would have all heard about AHAs, BHAs. So you have AHAs in which you have glycolic acid, lactic acid, mandelic acid. You have BHAs in which you have salicylic acid. Then there are certain polyhydroxy acids. There are certain hydration actives. So your hyaluronic acid, which you've been discussing, is a hydration active. Then you have certain brightening and glow actives in which you have vitamin C, you have glutathione, arbutin. So these are all actives, and based on your skin type you should decide the active. If you are unsure, then don't experiment. I would suggest to recommend you to ask a dermatologist, a qualified dermatologist. According to your skin type, you can go for the actives.
Right. So if someone has oily skin type, what are some of the few actives that you would recommend? And for dry skin type, what are some of the few actives that you would recommend?
Yeah, so for oily skin type, hyaluronic acid is a good active to use. Why? Because hyaluronic acid, though, let me tell you, it's a humectant and it tends to absorb water. So the most
Right.
important function of hyaluronic acid is that it moisturizes. But it is a boon for people who have acne. Why? Because it tends to have an anti-sebum action. It has an anti-inflammatory action. It also helps with your scars.
Okay.
So hyaluronic acid is good for everybody, whether it is a oily type, it is a combination skin type, it is a dry skin type. It is good in all cases. So for oily skin, hyaluronic acid is very good. Other than that, you can go for, so that depends on your condition. Like you asked for oily skin, so it depends. Like if you have acne, you would have different actives. If you have pigmentation, you would have different actives. If somebody is facing pigmentation, I would suggest them to go for a glycolic acid based active. If somebody is generally having, so you're talking about talking about oily skin. So if somebody is having acne, I would suggest them to go for a salicylic acid based serum. So accordingly, it changes according to the skin type, you know. But
Okay.
in general, for oily skin, a good skincare routine would be to use a cleanser. So cleanser can be a gel or a foam-based cleanser. So all of you would have heard of CTM, cleanser, toner, moisturizer. So toner is not very necessary, but people who have oily skin, they can use a toner. Why? Because they have too much of oil, and toner can help to remove the excess oil that stays after your cleanser has been used. You still have excess oil, you can use a toner. Also, those you who are used to using too much makeup, their toner has a role, and excess of dirt, sebum, or makeup particles which are left, toner can be used to get rid of them. So after cleanser and toner, you can go for a serum and then go for a moisturizer. So for oily skin types, I would recommend non-comedogenic oil-free moisturizers, lightweight, in a gel or a lotion form. So that will be the best one. And then of course, after that, go for a sunscreen.
Okay, got it. So the basic routine is CTM, and then based on your skin type, you need to use sunscreen as a must again. And based on your skin type, you can customize the routine to how you like it, right? So one of our audience members has a question. Nidhi Kumar 26 asks, what are the best treatments for anti-aging, and is 23 a good age to start?
Actually, there is no particular designated age to start anti-aging treatment. So let me tell you one thing, like when I sit in my clinic and people come to me for Botox injections, everybody would have heard of that. So that is an in-clinic procedure for anti-aging. So they say, doctor, I'm 35. I think I'm too young to go for Botox injections. And that's not true. So the actual age at which you should start Botox injections is actually 25. So that is just an in-clinic procedure. When you talk of anti-aging, there are multiple aspects to it. So there are certain lifestyle modifications, then there are certain skincare things that you can do, and then there are in-clinic procedures. So lifestyle modifications should always be there, like taking a good diet, taking adequate 1.5 to 2 liters of water every day, avoiding smoking, drinking less alcohol. All these go a long way, because if you incorporate all these in your lifestyle early on, you would not develop those wrinkles and those changes in your skin texture that early that somebody who doesn't have a good lifestyle does. And then of course there are multiple other skincare ingredients that you can incorporate in your skincare routine. So hyaluronic acid is one. Then using hyaluronic acid, lactic acid, using moisturizers, using sunscreen. So having a good AM and PM routine is very good, because that tends to delay your aging and your wrinkles and your fine lines. So that is, even if you're very busy, you can do a basic routine of using a cleanser, using a moisturizer, and using a sunscreen. That is something that you should always find time for. Even if you feel you're very busy, the way you find time for things which are important for you, just find out 10 minutes for this. And trust me, you will thank me for this 10 years down the line. and then there's certain
Exactly.
and then there are certain anti-aging procedures which are done in clinic. So that is a altogether different discussion. In that we have your botulinum toxin injections, you have hyaluronic acid fillers, you have chemical peel. So there are a couple of things in that.
Okay, so lifestyle changes are a really big part of delaying the aging process, right? And around 25 or so is when you can actually start considering any kind of treatments for aging and your skin aging, right? Okay, so we have another audience question. Jagannath, my team is actually queuing me about the question right now, so I'm just going to ask you the question. Jagannath is asking, ma'am, I keep switching brands, and as every brand serum is almost the same and the ingredients are similar to hyaluronic acid and niacinamide, do these two ingredients actually affect skin?
Yeah, of course. Hyaluronic acid, as I told you, is a wonderful, wonderful ingredient. It is good for every skin type because you know what? It acts as a sponge, and you know it absorbs around 1,000 times the weight of its own, and it expands. So it hydrates your skin. It's basically a hydration active. But in addition to that, it also heals your skin. It is anti-inflammatory. If somebody is having flares of acne, it heals that also. It also there are studies that have proven that when you use hyaluronic acid for over 16 weeks, there is a decrease in the amount of visibility of the acne scars. So that also helps. It improves your fine lines. It improves the texture of the skin. So it is a very good product to use when you are maybe starting your skincare routine. You are a beginner and you don't, because there are multiple actives in the market, and right now you're a beginner and you want to start with something. Starting with hyaluronic acid is a good idea. And he asked about one more active. What was that? The question is two
Hyaluronic
actives.
acid and niacinamide.
So yeah, niacinamide again is a very good product. Actually, it is a vitamin, and it also tends to nourish and moisturize your skin. It softens your skin, and again, it is niacinamide, vitamin C, vitamin E. These are like products you can never go wrong with. So these products which I mentioned right now, so these are things which a beginner can start using. And then according to your skin type, if you want to go for other actives, so there are multiple other actives, then you should choose it according to your skin type. And it's always better to ask a specialist when you want to incorporate any other actives.
So just one small follow-up question based on what everything that you told us about hyaluronic acid and niacinamide. Does it matter if you switch brands continuously, like one for a month or something? I try one brand and then I move on to another brand with these ingredients.
I wouldn't say that it would make that much of a difference, but it is advisable to use the same brand. It is better that way, you know, because
Because the
sometimes.
concentration or
Sorry.
the concentration of the
Yeah,
ingredients,
that
or
of course, I'm assuming that you're talking about the same concentration in those brands. Of course, if the concentration changes, then of course there is a change in the efficacy of the product. But if we, in general, of course, that happens. That if that is a change in concentration, then there is a change in efficacy. But sometimes what happens is, you know, choose a brand where, choose a product and a brand where the products are, you know, fragrance free, sulfate free, paraben free, non-comedogenic, you know. And if something suits your skin type and it's a good product, it's better to stick to that rather than trying new things, so that your skin
right?
gets used to it and does show a response. Also, you should be compliant. Some people do one thing, they will use the product for 2 to 3 days and then they will expect a miracle. So that doesn't happen. You have to be patient with your skincare, and just, you know, I tell my patients that just like you go to bed, you brush in the morning, you get up and you brush, just treat your skincare like that. Keep it with your brush and your toothpaste. You know, just make it a habit. You don't have to think consciously for it. Just your AM and PM basic routine should be your habit.
Okay, so a regular skincare routine that you follow religiously in your routine is a must, right? To take care of your skin in a healthy manner. So, guys, these are the last few moments that we have with Dr. Soumya. So, if you have any questions, quickly drop it in the comments below so that Dr. Soumya can answer all of our questions. Meanwhile, Nidhi Kumar 26 has asked another question. Can we combine vitamin C and hyaluronic acid? So, the serum that we are talking about today has vitamin C and hyaluronic acid. So, is that combination good?
Yeah, that works. Yes, you can combine both of them. So vitamin C is basically a brightening agent, a glow agent, and your hyaluronic acid is a hydration active, and that is a brightening active. So both of them can be combined because the way they act is different, and they will tend to complement each other.
Oh, so both the ingredients complement each other and can be included very safely in your skincare routine, right? Okay, so another question is, what about ingredients like argan oil and oat amino acid for oily skin type? Does it actually help with oily skin type? If so, how? Because using more moisturizer, a lot of people have the misconception that, you know, it'll cause your skin to become more greasy.
So oily skin, the moisturizer that you choose is one which is oil free, which is, it is better to use a one which is lightweight. So argan oil, like you asked about, it is actually obtained from a argan tree, which is found in Morocco. Okay, and it's basically a moisturizer. It hydrates your skin, and it makes your skin supple and soft. And the good thing about it is it's not very harsh on your skin, and it's lightweight also. So that way, it will work well for a oily skin type. So you can
Okay.
use that even for a dry skin type. It can be used.
Okay, fine. So argan oil is like essential for oily skin type, right? What about oat amino acid
So
or any product with amino
yeah,
acid?
so oat acids again, they are obtained by hydrolysis of the oat proteins. So that is also a good product, and it's specifically very good. It will be good for a oily skin type. So that is a
Oh,
good product.
thank you so much, Dr. Soumya. Guys, if you guys have been enjoying the show, please type in the comments below I am and let us know that you guys are enjoying the show. If you have any more questions for Dr. Soumya, do drop them in the comments below. And Dr. Soumya, uh, what is salicylic acid and like when should it be used during the day, during the night, or how frequently can it be used on your skin?
So it's a beta hydroxy acid. Again, it's a active. Okay, and basically it's useful for acne prone skin. Basically what it does, it exfoliates your top layer of the skin. It's a keratolytic agent. So what it does, it that the top layer of your skin, the cells which are there, it tends to break the bonds between those cells and tends to move those cells away from each other, and that way what happens is the top layer of the skin is shed off. So when you are having acne and your oil glands are producing excess sebum, so the basic lesion of acne is a comedone. Okay, so that is basically due to plugging of your oil glands, sebaceous glands. So there is a pilosebaceous unit, which is a hair follicle which is attached to a oil gland. So due to that plugging, so sometimes what happens is they are getting formed inside, but right now they are not visible. So when you use salicylic acid, it tends to have such a action that those which are not visible are also removed from your skin. So it tends to have an anti-sebum action. That is why it is a very good product for people who have acne. So it's a boon for people who have an acne prone skin, and it is recommended to use it 3 times a week. Better to incorporate in the PM routine because it tends to exfoliate. That can be done.
Okay, got it. Thank you so much, Dr. Soumya, for explaining that in detail. We have one more question from Hayati Khan, and she's asking, is glutathione better taken orally? I'm sorry if I didn't pronounce that right.
Yeah.
It's very difficult.
So glutathione is something which is very much in the wash, and it is used as topical glutathione. It is used as oral glutathione, and then there's IV glutathione also. Injections of glutathione are given. So topical glutathione you can use, but 50-50 efficacy. You might have a response. I wouldn't say that there is no response, but you have to use for a long period. Oral glutathione, again, you have to use it religiously, at least 1000 mg daily for 4 months. Then only you would see a response. And then there is IV glutathione. Now, IV glutathione, the problem is that it is not US FDA approved. So though people tell that it is useful and many doctors do give it, personally, I feel that because we do not have adequate data available on what are the side effects behind IV glutathione, personally, I do not recommend my patients to go for IV glutathione. Another thing is that when you use IV glutathione, once you might see a little bit of a lightening effect, but sometimes when you stop using it, you get back to normal. So you have to keep getting those injections continuously. So that is again very difficult, and then also it affects your body in general. So getting injectables all around the year. So I personally don't feel that you should go for IV. Using topical glutathione, you can do oral also. You can do. The problem with oral is that a lot of it gets through the liver and is not used up in the right place where it should be used up. So again, that efficacy of oral is also 50-50. I wouldn't say that if you take it, you will 100% have a skin lightening and you'll be a tone lighter. But then definitely there are people who have had response with that. So if you are really wanting for that skin lightening, then you can go for that. You can take a trial of 4 months. So that can be done. Definitely check your thyroid function tests and liver function tests before you plan on taking glutathione, because there are certain reports of having derangement in liver function tests and thyroid profile on glutathione.
Right. So glutathione needs to be consulted by a doctor and prescribed
Yeah,
to
definitely.
have like proper effects on your skin, right? So, and topically, there are a lot of creams and other solutions available that we can,
that can be done.
maintain a consistent skincare routine. So, guys, if you guys are enjoying this live show, enjoying talking to Dr. Soumya here today, type in the comments below, I do, or let us know by sharing hearts so that Dr. Soumya also knows that you guys are absolutely enjoying this live show. Dr. Soumya, one last question before we let you go. Could you share some tips and tricks that can help control signs of aging?
Yeah, so I think half of it I already spoke about. So I, as I
Yeah.
told you, there is certain lifestyle factors, then there is certain skincare routine, and then there are certain in-clinic procedures. So the lifestyle factors, take a balanced diet, have a good circadian rhythm. So sleep for 8 hours at least every day, and just sleeping for 8 hours is not adequate. Sleeping at the same time every day. So have a, so that your body adjusts to that time and your body has a good circadian rhythm. That goes a long way in not having signs of aging, right? Then drinking 1.5 to 2 liters of water every day, avoiding smoking. Smoking definitely, increases your aging effect very fast. Then drink less of alcohol. If you don't drink alcohol, again, very good. Uh, Other than that, I would say follow a AM and a PM routine, a basic AM and PM routine. If you're not a person too much into skincare, at least a basic AM and PM routine goes a long way in preventing you from developing signs of aging very early on. So that is one thing that you can do. Incorporate certain actives like hyaluronic acid serum in your day-to-day routine, lactic acid, hyaluronic acid, glycolic acid. These are certain things which help with your anti-aging. Then retinoids. Again, you have to use retinoids very carefully. So I wouldn't, me saying it, but if you use it, definitely consult a doctor before using it. But retinoids are basically a golden drug, which basically reverse the signs of acne, but signs of aging, I'm sorry, but they have to be used in a proper way. So I've had many patients who just listen on Instagram to some reel and they use it and then they come with a flare, and so that happens. So actually you have to use it in a very small pea-sized amount, and it has to be used in the evening, and then you have to also see your skin type. And initially it can cause a bit of irritation, so I tell my patients to wash it off in an hour. Gradually, as they get adjusted to it, then they can leave it for a longer time. Using a retinoid in your skincare even 3 times a day goes a long way in having that perfect blemish-free skin. Then, of course, there are
Yeah.
certain in-clinic procedures that we talked about. So that is botulinum toxin procedure, hyaluronic acid serum. Then you have chemical peels, right? You have laser, and you have multiple other things depending upon the requirement. If somebody has sagging, then you have thread hip. So depending upon what is the particular thing, problem with the aging. Like somebody has under eye hollowness, then we do a hyaluronic acid filler. If somebody has forehead wrinkles or a crow's feet, then we do botulinum toxin procedure. So that ways, according to that, the right procedure is.
Okay. So using certain skincare routine consistently, and again, like you said, I can't stop emphasizing on having a balanced lifestyle, how much it affects your skin, right? So having a balanced lifestyle, a good circadian rhythm, and using any product wisely on your skin is the key to having a good preventing aging for a long duration, as per Dr. Soumya. So I hope you guys all made a note of all the tips and tricks and information that Dr. Soumya has given us today. Thank you so much, Dr. Soumya, for joining us. You have really helped our audience get their skincare routine on track.
Thank you.
See you again soon on another live session,
Bye bye.
hopefully.
Thank you.